Here's a fact that should make every practice owner a little upset. So the practice down the street, right? Someone who looks like you, same size as you, same subspecialty as you, may be getting paid 15% more than you for the exact same services. Same CPT codes, same patient population, different contract, different rate. So for decades, payers have kept their negotiated rates basically a secret, right? And that gave them power. You couldn't prove you were being underpaid because you had no data. You just had to accept whatever they offered or walked away. Until now, that has all changed. So the federal transparency coverage rule basically forced every major insurance company to publish their negotiated rates. And for the first time in history, you can actually go and see what your competitors are being paid. And that data is your most powerful tool when it comes to contract renegotiations. So today we're going to talk about how to use this data to get your rates increased, at least if the payer is willing to show up and negotiate with you. Before we get started, I do want to share a couple resources down below in the show notes. We have an eligibility training toolkit that can allow you to read through the key strategies around eligibility and implement those to train your front desk staff. And then we also have a margin playbook, which is really all around patient AR. So check those out and download if you haven't already. So the federal rule forced payers to publish their rates. So a lot of those rates are on the payer websites individually, and their files are massive, right? So we're talking terabytes, gigabytes, massive amount of data that really a human can't realistically parse out. And they did that on purpose, right, to make it complicated. But there are now companies that are starting to parse that data out, put it into a tool that you can go and review and look at the data and see where you're at, and then use that along with a very talented credentialing team to be able to take and renegotiate your rates with the payers. Definitely want to check that out. Again, there's a couple different tools that are out there. Our team is using one of them that we can access. We can search by CPT code. We can look at geographic area and then see exactly what other practices are being paid. And you can even limit it to like a specific county. You can limit it by size of the group, subspecialty, obviously. It is a complicated website, but once you kind of get the hang of it, you can start downloading and seeing, okay, where do you fall in a span of 40 groups locally near you for a 99214 for Aetna or for Cigna or for United Healthcare. It's really a really cool, neat tool. And so today we're going to talk through kind of how you can use that type of data in order to renegotiation rates. So obviously step one is going to be getting access to the data. Again, there are credentialing teams out there that have access or who can go and pay access. And so once you have the data, the access, you can then use that to go and help streamline your renegotiations, which we'll talk through. So step two is really building your case, right? Pull your own practice's contracted rates for your top CPT build codes. And actually this tool also allows you to pull down your own fee schedule. So another nifty tool. And then you can compare that against the other practices, right? Using your zip code, your county, for that same payer for those same CPT codes and kind of see where you're at, right? Are you in the 25th percentile, 50th percentile, 75th, et cetera? And then you can pull out hospital-owned groups. You can pull out clinically integrated networks and compare kind of what all of those different types of groups are getting paid. Now, obviously, those organizations are going to have higher volume, leverage to negotiate higher rates. And so you can pull those out so you're not kind of having that skew the numbers. So you can look at groups that are kind of closer to your size. One thing that I can't see in here is how long a group has had the rates, at least not to my knowledge that's not there. So meaning if a group contracted those rates 10 years ago and they've just got to keep those rates, you couldn't really tell that from the data, at least the data that I've reviewed. And so one of the things that you can do, again, is to segregate by size so that you're looking at kind of same size, same type of group. So once you get your benchmark data, and if you identify, that you're below the 25th percentile, then basically that's what you use to benchmark and your argument in order to get paid, an additional 15 or 20% if you can, be able to get that. Step 3 is going to be actually pulling that data together to create a formal letter or an intent of renegotiation. So most payer contracts will require, written notice to initiate a renegotiation. You can't just call provider reps and ask for a raise, right? There is a formal letter and a formal process that credentialing teams would put together. And obviously you want to make sure that you're in your renegotiation period, right? So if it's a brand new contract, you're probably not going to be able to be successful in renegotiation. But if you've not renegotiated and it's been 3 or 4 years, that's probably the right time to start having those discussions. Not to say that you couldn't do it sooner, you just may not be as successful. So in that letter, you really want to show the payer that you are being reimbursed below the market rate for your area, and that it is a professional evidence-based business proposal. So really calling out things like your quality metrics, the number of patients that you serve within their membership, the volume of CPTs, just some of that detailed information so that the payer knows, okay, I am going to pay attention to them because I don't want them to walk. Because if they did walk, we'd be losing, a physician to cover our patients. And obviously some markets that's going to work better than others. Some markets are saturated with certain types of physician subspecialties, so it's going to be harder to renegotiate those than others. But it is at least worth a try. And step 4 is going to be able to evaluate your ability to walk away or go out of network should that renegotiation go south. So this is an important thing for us to talk through. So if you have your top 4 or 5 payers and one of them makes up 25-30% of your revenue, walking away from that payer is going to be extremely challenging, right? Unless you have a wait list or unless you have built up a mechanism by which to cover that revenue, or maybe you don't need that revenue, you could cut expenses. So this is the step that I think most practice owners skip or kind of get nervous about. And I do think it's a really important step for you to understand, okay, here are my top 4 or 5 payers. They represent X percent of my revenue or X percent of my patient volume. And if a payer is going to refuse to negotiate with me, what are my, repercussions? What can I do? Can I truly terminate? Or do I need to get more aggressive when it comes to negotiations? Do I need to try and get a provider rep on the phone? Do I need to show them the data that shows that we're being underpaid compared to our peers? Do I need to show them the number and volume of patients that we take care of, et cetera? Now, if it is a small payer and you can cover that revenue in a different location, like from a different payer, from cash pay services, from a membership fee, as something else to cover the revenue, then certainly terminate the contract and go out of network. You just have to be prepared to understand the financials behind that. And of course, I know it sounds scary. So if a payer is paying you 20% below market rate and you see 200 of their patients a month, you are losing money compared to your peers. But the other side of that coin is you need to make sure that dropping that payer isn't going to have a massive impact on your practice. And so really, really key here that if you do have plans to terminate the practice, that you know how you're going to capture that revenue. Now, of course, it is, kind of been said, payers do know which practices are going to walk and which ones aren't. So I really wouldn't threaten that unless you're truly prepared and capable of handling that financially. Again, the goal here is to try and come to the payer with the data, with the process, with all the key points of why you should get paid more and what good you're doing for the community so that you can negotiate that rate for a higher percentage. So again, this data is out there. It's extremely valuable. And it's been very interesting to start kind of poking around with this with some of our practices. So as always, if you are looking for some support when it comes to billing or credentialing services, head on over to notrevmd.com and either use the contact us form Or if you are looking for a free revenue audit, we look at billing metrics, sit down with your group. For groups that do qualify, it is head on over to our website, top right-hand corner, free revenue audit, and we'll be happy to schedule that up. So hopefully you guys have found this useful. Again, new nugget that I am just learning about myself, and so thought it'd be a cool tool and something worth sharing for you guys. All right, have a great rest of your day.